Today, we are dealing with the topic of preventing and addressing corruption in emergency and crisis situations. Of course, we start off by saying, how do we address this in emergency relief? Firstly, it's important to get cooperation of anti-corruption bodies within the environment. Throughout the emergency response cycle, identify relevant bodies who should be involved. In every stage, establish separate mechanisms to manage and monitor emergency financial aid flows, monitor the supply chain to reduce wastage of resources, leverage new ICT with information on donor aid, create domestic coordination mechanisms with local partners to facilitate better coordination at times of emergencies. Include anti-corruption funding along with recovery funds. Example, the inclusion of oversight bodies, civil society and investigative journalists. The use of public expenditure surveys to identify whether funds were delivered in accordance with the intended allocation. Conduct rigorous retrospective evaluations after each emergency response and update preparedness planning based on the lessons learned. During COVID-19 response to corruption, when COVID-19 pandemic started and lockdown was imposed, the President of the Republic of South Africa, His Excellency Cyril Ramaphosa, announced the relief funds and directed government and state entities and municipalities to set aside funds to procure personal protective equipment for employees. Now, the National Treasury issued procurement guidelines to guide all these entities in the procurement, and the risk of corruption was identified on the procurement of these PPEs. Now, as the Special Investigating Unit, we became proactive and issued a proclamation to be signed by the President. The President signed that proclamation to enable SIU to investigate the allegations. As we were investigating, on the management side, we had two governance structures that were in place. The two governance structures firstly included all the law enforcement agencies and other related departments under the what we call JCPS, which is the Justice, Crime Prevention and Security, and the Anti-Corruption Task Team. Such approach on corruption is multi-sector approach, which led to the establishment of the Fusion Center under the JCPS. And the Fusion Center was really to ensure that it provides a platform for all the law enforcement agencies to collaborate. And the Fusion Center was also fully endorsed by the governance structures. The Fusion Center was also augmented by the President establishing interministerial committee to expedite consequence management relating to the procurement of PPEs. The Fusion Center provided a framework for law enforcement to collaborate in the prevention, detection, and responding to all the allegations that were reported. The establishment of the Fusion Center is actually underpinned by the following principles: multi-agency approach to ensure collective effort and proper integration, effective coordination and collaboration of efforts, co-location of human resources, flexibility and agility, and operational adaptability, transparency in the sharing and exchange of information, accurate and shared identification, targeting of entities for investigation, safeguarding the confidentiality and security of sensitive information. It was also intelligence and prosecution driven. It was established to provide an immediate response by law enforcement agencies in fighting the scourge of corruption, in line with the proposed national anti-corruption strategy at the time. It had some of the pillars, and most of the important pillars were relating to prevention, detection, investigation, and resolution. And the stakeholders of the Fusion Center included, amongst others, as I said, all the law enforcement agencies, but the examples are the Special Investigating Unit, the Directorate for Priority Crimes Investigation, the Financial Intelligence Center, and the South African Police Service, and also the South African Revenue Service. With the PPE investigations, we received allegations against 5,600 contracts for investigation, and the value of those contracts was about 150 billion. Out of these investigations, there were outcomes, prosecutions, civil litigations for recoveries, and also some of the officials were disciplined and fired from the public service. The lessons learned is that the companies that were investigated, they overpriced the PPEs that were investigated, and the service providers charged rates for the supply of PPEs in excess of the regulated pricing list issued by the National Treasury, and the use of emergency provisions by the state institutions was questionable. There was also non-compliance with procurement regulations. So all of these really were some of the findings that we came to. Now, as part of the prevention mechanism, Special Investigation is the convener of one of the programs under the Anti-Corruption Task Team. As part of that process, we then established risk-based fora to deal with the corruption and the maladministration. One example of those forums is the Health Sector Anti-Corruption Forum, which dealt with the corruption, maladministration in the health sector. And that forum includes civil society, business, government, and law enforcement agencies. I would like to share with you some of the other emergencies that South Africa experienced. In July 2021, we had an unrest following the incarceration of the former president, and that also resulted in the country having to deal with an emergency situation, and we galvanized all the law enforcement agencies and all the other entities that were required. And as a result, as part of the learnings, the president commissioned a panel to do the investigation, and the panel came up with a report which also gave us some of the learnings. We also experienced, as South Africa, the floods in our KwaZulu-Natal province, and in the wake of those floods, there was, of course, also the funding that was provided. We found that over 4,000 homes were affected, and the cost of infrastructure and business losses amounted to an estimated of about $2 billion US. Now, as part of this, we ensured that we reviewed the controls and also ensured that all the individuals that were affected are also all identified and the funding is distributed appropriately. We had to make sure that we pull in the Auditor General so that the audit is done real time and that the payments related are also audited. We also did data analytics, which created an opportunity for us to assess what is it that went wrong. And of course, we saw an improvement in the government's agility to respond to a disaster in that way. So all of these learnings are in line, as I conclude, are in line with the document and the study and the discussions that we engaged in under the guidance of the United Nations Office on Drugs. We met, I recall that we met in Egypt and came up with about 13 principles on tackling corruption during times of emergency and crisis. Those non-binding guidelines really guided us in the process. Thank you.